Hey everybody, my name is Dr. Sharky and I'm a critical care doctor. COVID seems to be back in the news and I came across a couple of TikToks which came up on my feed about COVID and a couple of experiences from two patients who unfortunately had a bad time with COVID. So let's dive in.
One time I got COVID back in 2020 and I was like, oh, MG, this is the worst, but also I'm 21 years old. It should be relatively okay. I've never.
Yeah, so she's young, she's fit, she might get COVID and usually they do pretty well, but looking at her face, I think something might have gone wrong.
Had any prior health issues, but then I started getting numbness in my hands and my forearms, along with really persistent headaches, which I never really had before. I attributed this to just being really stressed out because I just started the serving job. I was crying in the walk-ins. You guys know how it is.
Yeah.
You know how it is.
So it's very non-specific stuff.
Numb in my mouth, and I'm like, that's not supposed to happen. So I go to the ER. I pass out in the ER. Drama queen. I know. They tell me, don't even worry about it. You're just anxious. Like they were agreeing with me. I was like, I knew it. Like so sorry to waste your time. I go back home.
Oh dear. So I guess she passed out and they probably didn't do any scanning or imaging. They probably should have scanned her head to see if there was something going on in her brain. But yeah, fainting attacks, sometimes they just, if you go into the ER, they're so busy, and if you recover completely and you're young, fit and healthy, they'll just send you back home, which I guess during COVID shouldn't have happened, because maybe it was early in COVID, but later on we would probably take a closer look at something like this.
3 months later, I'm hanging out with someone. My entire left side of my face starts to droop. They're like, okay, time to go back to the hospital.
Oh dear. So yeah, this is what I thought this was leading to. So it looks like she had a stroke, and that means she was paralyzed along one side of her body because of a lack of blood supply to a certain part of her brain. And you don't normally see this in a young, healthy patient. You would see this in older individuals who've got things like diabetes, high blood pressure, high cholesterol, etc. All things that'll help form clots or blockages in the blood vessels to the brain. But in COVID, I'm not sure whether this was due to COVID or whether she had a pre-existing condition that makes her blood tend to clot faster. But in COVID, we found out later on that your blood tends to clot much faster. And when that happens, especially in the smaller blood vessels, they'll just block off. And in her case, it's probably the blood vessels going to her brain, and she had a stroke, which is horrible for somebody who's young and fit like this.
I'm like, no, it's just anxiety. Don't you worry.
Oh no.
But sadly, not anxiety. It was a stroke.
It was a stroke.
Apparently, because my internal carotid arteries were closing up to be this teeny tiny small.
Okay, so yeah, that's exactly what we were talking about. So her internal carotid arteries, that means the two main arteries on either side of your neck going into the brain, were probably getting clotted off, and they were so narrow, at least one of them was very narrow, that it probably caused part of her brain to die essentially. And that caused a stroke. Well, maybe not die, but there was a lack of blood supply to cause enough lack of blood supply to cause her face and one side of her body to go paralyzed. But it looks like she recovered from it, from what I can see, or maybe not.
So they had to open them back up with stents, and I was like, great, okay, that's totally great. We're done. Haha, that was traumatic. Putting that in the past. I fly to New York City because what else am I supposed to do? And then whilst in New York City, I get numbness again, this time in my head, and they find a big old marshmallow of inflammation behind my eyeball. So I go back home because no way I'm dealing with that by myself. Absolutely no way. In New York City, are you kidding? And when I wake up from the flight, no vision. No vision at all. So that's kind of unfortunate. And now it's 2023, and no one really knows why all of this happened exactly.
Okay, oh, this is really sad. I really feel for this young lady. Um, Whether this was all due to COVID, probably, especially the strokes. Um, you can be young and get strokes. It's very rare, but you'll probably have some sort of condition, which we call sort of a thrombophilic condition. You tend to clot up, and they would have run tests to make sure she didn't have that. So I'm thinking it's most probably due to COVID, at least the strokes. The inflammation in the eye, I'm not so sure. I don't know what exactly, some sort of what we call retrobulbar inflammation, maybe. I don't know. But yeah, definitely COVID. So one of the things we used to do when we get patients, when we're treating them for COVID, especially on the intensive care unit, is we'll load them up with heparin, with drugs that stop your blood from clotting down, and we would give a big dose of that because like this young lady had blood clots that cause paralysis and strokes, but you could clot off anywhere, to the blood vessels going to your kidneys, into your lungs. That's really can be devastating. And yeah, it's really sad what's happened to her. I don't know how she's doing. Today, this was in 2023, so like 3 years after she got COVID. But yeah, this is pretty common, and it's more common in the older, sort of more overweight individuals who got COVID and who got very sick with COVID. Yeah, but well, I hope she's okay today, and hope they managed to figure out what's going on with her eye. That I don't know whether that's related to COVID or not. I can't comment on that. But yeah, okay, let's keep watching.
The first 24 hours was critical, and I was unconscious really in many ways.
So
I first met Mark when he was fighting for his life. He was in the intensive care unit at Warrington Hospital back in October 2020.
okay, so this looks like it's in the UK, and this is pretty much the setup that we had in intensive care. Looks like, was it Mark, the patient? Yeah, that's the kind of typical patient would have, who'd get very, very unwell with COVID. They'd be overweight, sort of short, having a high BMI, and I'm pretty sure he probably had some other medical conditions as well. Most probably, high blood pressure, maybe some high cholesterol, heart disease, things like that, and they would end up like that. And so what I could see was he's on a mask. He's wearing a mask, a very tight fitting mask. So that's what we called non-invasive ventilation. So the patient stays awake and sort of with additional oxygen, and it's pumped through with a lot of pressure to help keep your airways open. Well, let's keep watching.
It was when a second wave of COVID had started to take hold of the country.
So, to be honest, for me, it's still early days.
Are you worried about the next few days?
I'm worried, yes, but I feel safe, if that makes sense.
Oh yeah, poor guy. So yeah, it can be terrifying in the intensive care unit. And I work in the intensive care unit. That's my primary job. And for us, it's just day to day. It's part of the job. But for anybody going to hospital is terrifying enough. But when you go into intensive care, you know that you're not well. You're really not well, and everything that's going on in there's a lot of noise, there's a lot of sounds. It's very unfamiliar. There's so many machines in there. It's very overwhelming. And the things that we have to do to the patient, especially if they're awake, so it's not just the bits and bobs of monitoring and the sort of stickers and things we put on. There's lots of invasive things going on as well. So I'm thinking, because he won't be able to move around a lot, he's going to have to be catheterized. So that means he's going to have a tube put into essentially his pee hole and into his bladder. So he won't have to move around to go to the bathroom. And in addition, we do that so we can measure how much urine is producing. And then there are the lines that we have to put into his veins and And so he might have just some cannulas, some drips, and those are painful to put in. He might have what we call a central venous catheter, which is a big ass line that goes either in your neck, under your sort of shoulder here, or in your groin in some cases. And you might have arterial lines that are like sort of lines going into your arteries, so we can measure your blood pressure. It's going to be really painful, and we will give sort of local anesthetics when we're putting it in, but it can be awful for the patient. And so yeah, and he's got that tight fitting mask on his face, so that's the non-invasive ventilation. That means it's blowing air, or a mixture of air and oxygen, into his mouth and nose. It's been described as, have you ever stuck your head out of a window in a moving car when you were a kid? I guess they don't do that much anymore because we all have to wear seatbelts in the back. But that's what it's like. And say you're going at 80 miles an hour with your head stuck out the window, and you're trying to breathe against that. And that is exactly what it's like. So it's not pleasant. It'll keep you alive, but it's not pleasant. And some people don't tolerate that, and they have to be put to sleep, have a tube put down their throat so the machine can breathe completely for them. And they had to be sedated with that. And that's not pleasant either. Yeah, and it's awful for the patients. It really is.
5 years on, and Mark is a relieved man. Others on his ward that day didn't go home.
I have been told I've got scarring on my lungs, but it's not functionality. Whether it will later on in life, I don't know. So at the moment, it's still a process, but I'm a lot better than I was certainly 5 years ago. And it affects you in different ways. I mean, when I was in hospital and after, I had a lot of muscular pain. So for about 18 months, I probably couldn't even put a shirt on properly.
They saved your life.
Oh, totally. Yeah, I think I'd have gone on a ventilator, would be here. I don't know.
Yeah, so he says he's much better now. But of course, being in intensive care itself, it's going to knock you off your perch for quite a while. And with COVID, we don't really know what the long-term effects of COVID are. So we can see his lungs, especially his lungs, were going to be scarred. So he might be okay now, but later on in life, as he grows older, and he might have other issues. If he has a chest infection, it'll just take longer for him to recover. It'll cut years off your life, and not just in terms of living, but your quality of life after you've been in intensive care. And it doesn't matter if it's COVID or not. It's not going to be the same. Most people think you go into hospital, you go into intensive care, and you're treated, etc., and you come out the other side. You're not going to be the same person. You're going to be weaker. You're going to be what we call deconditioned. So it's not a magic bullet. So you want to avoid going into intensive care at all costs. But somebody like Mark here, he's kind of the typical sort of male patient that you'd get after COVID. Having COVID, they'll be overweight, have some health issues, and they don't cope well. And we don't know how well they're going to be afterwards either. I don't know, maybe they might do well, but the odds are they won't.
Mark knows that he'll live with the long-term health complications from COVID
Exactly.
the rest of his life. But he's thankful every single day for that opportunity.
Oh, that's so yeah, thanks for watching. It's just a couple of stories that I saw, and if you enjoy this sort of thing, please don't forget to subscribe. I've got other videos going on, especially my reaction series to The Pit, which I will be continuing at some point. Anyway, let us know in the comments if there's anything else you'd like me to break down. Stay healthy, stay safe. Good night.